السلام عليكم. الآن محاضرة ضمن محاضرة الإنكولوجي عن موضوع النيوروبلاستوما in the childhood. أنا الدكتور حسين العتابي من فرع طب الأطفال كلية طب الكندي في جامعة بغداد. Now, what is a neuroblastoma? Is the most common extracranial لاحظوا solid tumor of the childhood and the most common malignancy of infancy. لاحظوا بالinfancy نقصد بالinfancy اللي عمرهم أقل من سنة. It is derived from neural crest cell and can arise anywhere along the sympathetic chain of the peripheral nervous system. They are neuroblastomas most commonly in the adrenal medulla. Now for the diagnosis, starting with history, the general appearance, activity level, appetite. The patient with localized low risk disease may be very well appearing, i.e. يعني نقصد إنه tumor is an incidental finding on imaging study. بالصدفة من يسوون في imaging study يقول هذا tumor مع إنه patient is symptomatic. While patient with disseminated high risk disease typically appear ill. This is based on tumor location. Thoracic راح نشوف chest pain, cough, respiratory distress. Abdominal راح نشوف pain, swelling. Bone marrow راح نشوف fatigue, anemia because of the anemia, and so on. Now on physical examination, the presenting sign and symptom depend on the primary site of the tumor and the degree of disseminations. فمثلا بالabdomen عندنا abdominal mass is usually firm, fixed and irregular and often crosses the midline. Abdominal distension with or without tenderness, and there is maybe sign of bowel obstruction, anorexia, vomiting, low stool output. Also we might have hypertension due to renal artery compression and genital and lower extremity edema from obstructions of the venous and lymphatic drainage. Now diagnostic tests and interpretation. We might have CBC, complete blood count. There is decrease in hemoglobin, platelet and or white BC count, which might indicate bone marrow involvement. Also electrolyte, liver function test, renal function test in anticipation of starting chemotherapy. Urine catecholamine metabolites are typically elevated. This is very important to remember. Also hemavanillic acid يسموه HVA and vinyl mandelic acid. We have also imaging study, generally an ultrasound or CT scan of suspected primary tumor site. MRI may be necessary for paraspinal tumors. Classification suggests neuroblastoma. اكو يسمونه ميتا ايدو بنزيل جوانيدين اللي هو MIBG scan. It is taken up by 90% of neuroblastoma. عندنا ايضا radioisotope labeled MIBG scan detect both bone and soft tissue involvement. Bone scan to evaluate for bony metastasis. Only necessary if the tumor is not MIBG and AVD. Also on the treatment, medication, drug, multi-agent. Chemotherapy typically include a combination of vincristine, doxorubicin, cyclophosphamide, cisplatin, carboplatin, etoposide, 6-MB, 16 VB16 and or tropocam. طبعا هذه الدراجز ما مطلوبة ان تحفظوها، عارف صعب عليكم بس للمعلومات العامة. In the high dose ablative chemotherapy is followed by autologous stem cell transplant. بالعادة انه تحتاج الى stem cell transplant. 13 cis retinoic acid induce differentiations of neuroblastoma cells and improve patient survival following stem cell transplant. Immunotherapy with antibodies directed against GD2, which is present in most neuroblastoma cells. Radiation therapy is used for control of local disease or for palliation. Surgery and other procedures, total surgical resection at the time of diagnosis may be attempted, but not if it would involve significant morbidity. Thank you and good luck.